to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks.
Hey rock stars, this is Eric Peguero, and today we're going to be talking about 5 common causes for infertility, or as I like to call it, the conception conundrum, exploring the causes and solutions of infertility. And we have an expert who is a member of our community, of our Rockville chamber. And I'd like to welcome you, Dr. Yemi. How are you?
Thank you so much, Eric. It's a pleasure being with you on this wonderful Saturday morning.
Absolutely. Now, do me a favor. Tell me your last name because I love it. You pronounce it perfectly and I kill it.
So what I tell patients, it's break it up into phonetics, right? 2 letters at a time. Famuyiwa. Famuyiwa.
Famuyiwa.
Correct.
I love it. Where's that from?
That is actually from Nigeria. A lot of people think it's Japanese, but it's not. It's from Nigeria.
Okay, Lagos.
It's a traditional name in Ogun State, which is Abeokuta, which is kind of north of Lagos. I did grow up in Lagos, but you know, Nigerians, we like to claim where our father came from, right? So Abeokuta is the city under the rock, and Abeokuta citizens are extremely proud of that rock. So that's where I originate from.
You know, I don't know for people that may not know this, but Lagos, Nigeria, is actually one of the most sophisticated cities in the entire continent of Africa.
It sure is.
You know,
yes.
Yeah. So one of the places that I want to visit when I am able to go there, because I know it's very expensive to get to Africa.
Come on, Eric. Come down with me and my husband when we go next.
There you go. I might take you up on that. So how long have you been practicing medicine?
So, gee whiz, Eric, I've been out a little bit. I graduated medical school in 1989. I did I went to Emory University Medical School. Great place, great town in Atlanta, as they like to call it, Hotlanta. And then I came to Georgetown University Hospital for my residency, where I did a specialty in obstetrics and gynecology. That was from 1989 to 1993. And I just fell in love with this whole DMV area. My original plan was to go back to Atlanta because I thought Atlanta was it. But then I came out and I just kind of love this place. I love it. And so when I was looking for fellowships, I did my training in infertility at the National Institutes of Health. I interviewed all over the country. And I stayed here because I really didn't want to leave this area. I loved being here. And I stayed at NIH, it was supposed to be a 2-year fellowship, but I was there for 5 years because I was doing research. I fell in love with research. It's kind of intoxicating when you're doing research, you're publishing, you're going all over the world to present your findings. I had a wonderful mentor. You know, I'm a science junkie. I loved it. And so when I decided, okay, I actually like taking care of patients. Maybe a little bit more than I like being in the bench research part of things. So I got married in my fellowship, and my husband also loves this area. So we decided, you know what, I really don't want to move, but I do love my patients, and I want to be of service. I want to be helpful in my community. So I opened my office, I bootstrapped it up, and it's been growing ever since. Officially opened 1999. And
oh, wow. So you've been around
I've been around a little while.
Yeah.
Yes.
Okay. So this is not a new business. This has been around.
Yes. It's been around.
You know, as you and I were talking and preparing for this podcast over the last couple of weeks, We talked about infertility, and man, I've got an education now on that. That is amazing because I had no idea that so many things can contribute to infertility.
Yes.
And so, the conception conundrum, right?
Yes.
We're going to explore 5 causes and solutions of infertility.
Yes.
Right?
Yes.
So there are many different factors that can
Correct.
contribute to infertility, right?
Correct.
Let's agree on that.
Correct.
And can be caused by a combination of factors.
Correct.
But these that we're going to talk about today are probably the 5 most common causes of infertility. Yeah. So let's talk about number 1, age.
Age. Women are born with all the eggs they will ever have. As a matter of fact, the most they will ever have is when they're about 5 months old in their mother's womb.
Oh.
Because of the rapid growth of the initial cells that make the ovaries, they go from about 1,000, we call it progenitor cells, and they develop into eggs to break the DNA content to one part so it can merge with the sperm again. There's a rapid growth. And you end up with about 6 or 7 million eggs when you're about five months old. During that rapid growth, you have mistakes that happen. So the body's way of clearing up those mistakes is to kill off the malformed ones. By the time the baby is born, you're down to about 2 million. You've lost like 4 million eggs.
That is amazing.
And then at birth, by the time a woman starts having her menstrual cycle, you're down to like 200,000-ish. Out of that, maybe only 4% will ovulate in the woman's lifetime. So a lot of things happen. And while the egg is in stasis during all of this, it is open to environmental effects, toxins, anything can happen. So the body's way of, and all these effects cause damage. In other words, the eggs get older. So as you get older, you're losing the eggs and they're getting older. They're not as efficient at forming a child anymore.
What you just explained is on the women's side. Do men experience a decline in fertility as age?
The greatest misconception is that, men are fine. They keep making sperm forever. Correct. They keep making sperm, but not efficiently anymore, right? So the cells that divide to make the sperm continue that process, unlike the egg, okay? But they are also open to having errors as they are being made. Those errors accumulate over time. So you have what is called DNA fragmentation, where the DNA is not quite right. And that increases with age. So lo and behold, men's sperm sort of kind of gets older as well, right? As a man gets older. So yes, men need to watch out.
So you can't be having kids at 80 years old,
Well, you increase your risk of having autism spectrum, schizophrenia, genetic damage, a risk of what we call aneuploidy. When you're using sperm, if you're 80, 90, 100, you're going to put out a lot of abnormal damaged sperm.
Let's talk about number 2, hormonal imbalances.
That's probably one of the most frequent one. The most common one that people hear about is called polycystic ovary syndrome. And some of this can be environmental, and part of it is also inherited, and part of it is as the girl is growing up. So the hormones can be imbalanced in such a way that women that have it don't ovulate in a regular manner. They have eggs, they have good eggs, but they're just not releasing those eggs, right? So that is another common cause called polycystic ovary syndrome. So we usually make that diagnosis when those patients have difficulty getting pregnant, is when they call on us. So that is a number, and that needs to be addressed before those women can get pregnant.
As we go through this list, right, and things like this are very complicated.
Correct.
I just want to really urge, our listeners, that if you are going through this or a family member is going through this, speak to your doctor.
Yes.
Especially a specialist in this, because it's easy sometimes to get information from the internet, from a podcast, and make our own conclusions. Oh, that's what I have.
Yes.
Okay, now I got it. No, speak to a doctor, make the investment and see what it is, because it may or may not be that.
Correct.
And there's a solution for this, right?
Absolutely. It's totally treatable. And when people go out and Google all types of topics, and, the loudest people will be heard the most. And sometimes those are not necessarily scientific people. So people come with misconceptions, or they take all this, homemade remedies that may do more damage than good.
Right.
So talk to your doctor, reach out, talk to your primary care doctor. They will help you. Reach out to your local medical society, teaching hospitals. There's information if you know where to go to. American College of Obstetrics and Gynecology, American Society of Reproductive Medicine. So get the correct information.
All right, let's talk about number 3, structural issues. What does that mean?
Yes. One of the things I tell my patients, give me 3 ingredients to make a baby. I need sperm, I need eggs, and I need a uterus. Structural, the uterus. I need a place for this baby to grow in. We don't have an external uterus yet. It may be on the works, but we don't have it yet. So one of the causes of infertility is a lot of women having fibroids, or they have damaged uterus from surgery or from endometriosis or congenital malformations, or they have something in the uterus such as polyps that dislodges the baby all the time, or they have a malformed uterus. So if you're not getting pregnant and you have sperm, you have eggs, we need to check the uterus out. I call it the plumbing. What's going on down there? Because if you don't fix that, you could have the best embryos in the world. You will not get that baby.
Let's talk about lifestyle factors.
Yes. Remember I said as the eggs are being developed and the sperm is being produced every single day. By the way, the egg is the largest cell in the human body, and it needs to get that large because it needs to power all the initial division of the baby. So if you have your eggs or the sperm in an environment that is toxic, then you're going to have problems. So the environment is very important that we look at. So what do you look at? Environmental, is it toxins in the environment? It's good to look at what's in your environment. Alcohol, smoke, or smoking in patients.
And I noticed you also mentioned off camera that you mentioned obesity is a problem as well.
For patients who are obese, their body is in a state of what we call the high inflammation state. When you're obese, you get a lot of inflammatory products. That inflammation affects the eggs and affects the sperm. So if you are overweight, try to lose some weight. You might find getting pregnant might be a little bit easier.
When we talk about, lifestyle factors, is this something exclusive to women, or is it both can contribute to this issue?
I think it's totally both. It's not just a woman's lifestyle. It's also the man's lifestyle too. So if they consume excess alcohol, it damages the sperm. So the environment in which the sperm is developing is critical.
So now let's go to number 5. And for all those folks that think maybe we're picking on the women, now let's talk about male factors. Guys, you are not off the hook.
Absolutely. Totally not. So we have to look at what causes low sperm, what damages the sperm. So if you're trying to get pregnant, what are you doing that affects your sperm? Smoking. Believe it or not, marijuana. I've had men that had beautiful looking sperm, and then we end up getting crummy embryos all the time. I'm like, what is going on? Marijuana affects the sperm. Excessive alcohol. Alcohol is not a vitamin. As a matter of fact, Canada has put out a warning saying, look, you shouldn't even be drinking more than 2 drinks a week.
Wow.
It affects the sperm. Too much alcohol, too much smoking, marijuana, excessive marijuana, medical marijuana, it affects the sperm.
That is amazing. And it's you just blew my mind right there, because as we as a society, make a lot of this recreational drug use and alcohol and all that, it's all legal. It really will affect our numbers in terms of reproductive capability, is from what I understand what you're saying.
Yeah, absolutely.
And even if we are able to reproduce, the quality of that reproduction, right?
Yes, the quality is not as good.
Wow.
It's not as good, yeah.
Got a question, and this is funny, just struck me as funny when you said that. You said good-looking sperm. What does that even look like?
Would you believe that we look at the shape of the sperm? We call it the morphology. If the sperm is malformed, it just doesn't fertilize an egg well. So part of when we analyze the sperm, and by the way, some even are calling your semen analysis is your fifth vital sign,
Wow.
right? The shape of the sperm. Is it moving well? Does it have is it bent or crooked? All those things can affect fertility.
And what is sperm motility?
Motility is is it moving in the right direction? Is it moving in a progressive fashion? So abnormal sperm doesn't move as well. So that will contribute to the motility. Abnormal sperm is bad shaped. So we also look at the what we call the morphology, the shape. Then we look at the pH, it has to be alkaline, right? And then we look at the numbers. What is the concentration of the sperm? So if the concentration is very low, then there's something going on. So we look at the semen analysis because it can give us clue. I've evaluated some men where all I noticed was that the sperm count was low, or something was off with the motility or the shape. So I referred them to a male urologist, which is a fertility doctor for men. And sure enough, we found out they had testicular cancer, and that was why the sperm was
Oh,
abnormal.
wow.
So yeah, so it was one clue that leads us to the next and to the next. So we do analyze that. It's one of the critical tests that you will get when you come to see me.
So, a couple of questions and just finishing off, and thank you so much for all this information because it's very enlightening.
Yeah.
One, is this something that maybe in family planning, a young couple should maybe come and get tested from a facility like yours? Or is this something that their regular primary care doctor would do?
Well, they certainly can go to see their primary care doctor. However, understand most primary care doctors, they're very busy, right? So they just, they don't have the time to go into more detail. So if you're trying to get pregnant, reach out to a fertility doctor. Your primary care doctor may direct you, but primary care, they're very busy with just your routine health. So they may not focus as much on your fertility part. So if you're not getting the right answers, reach out to a fertility doctor. I mean, you'll get a fertility doctor all over the country right now.
I remember when we were having our last child here. We were both 35 at the time. And one of the things they said that after she got pregnant, that this is, I guess, an injection or something that they could take a sample through the umbilical cord or right to the belly button to see if there was going to be any autism or some. But is this something that I would want to maybe? We didn't do it because it also can cause a miscarriage, right? But my question to you is that by going to a fertility doctor, if you're serious about reproductive, about getting pregnant, right? And finding out, is my sperm good looking? Is the uterus, all this, are these tests that I might want to run up front so I can know?
So I think I would encourage people to have, we call it a preconception counseling. So if you think you want to get pregnant, reach out to a fertility doctor. It's a preconception. So they can tell you what are the things you need to have in place. How can you get your body ready for getting pregnant? So I think seeing a fertility doctor, reach out to them wherever you are. Reach out to one and reach out to one that you feel comfortable
Gotcha.
with, right? So there are
Yeah.
different styles, and there's no right or wrong. I am more of a hands-on, touchy-feely, teamwork kind of
Okay.
physician. There are others that may want more. This is the way it is, and there's no right or wrong. You have to figure out what works for you.
What works for you? And I guess my point was that I want to let people know that, hey, it's not when you can't get results that you go see a fertility doctor. It
Correct.
might be to say, hey, how do I get the results I'm looking for? What do I need to do? What do I need to cut out? What I need to, uh, you know, anything that can prevent is
Yes.
better than anything that you have to react to, right?
Absolutely. It's better to get your body ready. So we call it preconception visit.
I love it. I love the fact that it exists.
Yeah.
And is this something that my insurance company would typically cover, or is this out of
Usually,
pocket?
we're very blessed in the state of Maryland. In the state of Maryland, fertility workup and it's covered. It's some states that it's not covered. So we're really blessed in the state of Maryland that fertility is covered and that workup is covered.
Is that with or without a referral?
With for most part without a referral. I mean, Blue Cross Blue Shield is really good about offering services, and usually without a withdrawal referral. I think most cases maybe United might not offer that, but Most of the insurance around here does cover. Yeah.
Okay, good. So yeah, check with your insurance company, make sure that
Yeah.
you can do something. And if you get a chance and you're looking for something, please reach out to Dr. Yemi. I mean, it's just been wonderful for the past few weeks, really getting to know you and being able to talk through this and just the new education that I have in this. And you make it very simple, very understandable. So I really appreciate that.
Thank you so much, Eric.
And Doc, before you leave, give us your information so that if somebody does want to reach out to you, they can.
Yes, please reach out to me. The easiest email is FAQMFC, frequently asked questions MFC @gmail.com, or look us up on MontgomeryFertilityCenter.com. So Montgomery Fertility Center, one word, .com. Email is FAQ, frequently asked questions MFC @gmail.com.
Dr. Yemi, thank you so much for being with us.
Thank you so much. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.